Welcome to another edition of Desi States of America. I'm your host, Rajiv. As you may now know, this program is dedicated to tackling a complex topic and simplifying it so you can digest it and maybe even regurgitate it to friends. Because that's my specialty, after all. I take the complex and I simplify it, and I take the simple and I complicate it. Ask anyone who knows me. Plan to leave a full-time job and jump into comedy? Decision made, no problem. Do I want coffee or tea? Let me think. I'll get back to you on that one. As always, we'll start with an overview and then the past, present, and future. So, this week, we dive into that monolithic topic of healthcare. That is one of the hot-button issues of this election and has been a problem for years. In fact, costs have become so bad that we don't even report them as part of the national debt. The national debt is $9 trillion. But if you add in entitlement programs such as Medicare, Medicaid, and Social Security, it's more like $60 trillion. $60 trillion. And we're talking about $9 trillion? Talk about randomness in reporting. I owe you $9. Well, I really owe you 60, but that other 51 isn't important. Wait, what? So, pretty much everyone agrees that the current system is broken, and so it needs to be changed. That's a start. You don't have the classic liberal versus conservative debate, with the former arguing change and the latter purporting the status quo. So what do both sides agree on? Let's start there. Both parties agree healthcare insurance shouldn't be tied to your employer. I mean, that system sucks, dude. If you lose your job, you lose your coverage. And it's bad enough that you no longer get free bagels and coffee in the office. After that, though, the sides, namely Barack Obama and John McCain, differ. How? We'll get to that. So, first, how did we get here? Historically, the U.S. government didn't provide health care because the role of government was more to protect people from other people, not from disease. In the 1920s, advanced medicine took off and the modern healthcare industry was born. In short, inequalities in health were directly related to inequalities in wealth. The problem was compounded after World War II. During WW II, which is actually the short form of World War II, but it actually takes longer to say, the government financed the war by printing money and by price and wage controls. Corporations began to offer medical care as a fringe benefit. When the IRS started making them report them as real wages, workers complained because they were now taxed on something that they used to get for free. And so Congress passed a law that ensured, not insured, but ensured, although I think they changed that health care remains tax exempt. So the conclusion is that we can blame World War II for everything, just as we can blame it for putting women in the workplace. I mean, we wouldn't have so many problems if they would have just stayed home and breastfed the kids now, would we? Can't imagine that being controversial at all. Anyway, during Nixon's administration, HMOs, health maintenance organizations, or HOMOs, actually I don't think that's really right, were born. These large third-party insurance companies eventually became the middleman between the patient and the doctor. And it's not a good system. In every other industry, the more cases you ship, the more money you make. In insurance, companies try to cover as many people as possible and then treat as few people as possible. They're actually rewarded for not providing a service. Does this sound familiar? Well, if you saw Michael Moore's movie Sicko, then it should. The number you often hear bandied about is 47 million. That's how many people without health care are in this country. Now, it's a little disingenuous because it includes children who often don't really need health care because they're covered in some other way. Funny how people like inflate or deflate numbers according to their needs, right? I mean, $9 trillion national debt, not $60 trillion, 47 million uninsured versus, and I don't even know what the other number is, that's how good they are at covering it up. Well, Sicko didn't focus on the uninsured. It focused on those of us who have coverage, but not as much as we think. In other words, you might think you'd be covered for a procedure, but you find out that you're wrong. So the subjects of the movie were largely people who were underinsured, not uninsured. So, why do insurance companies run healthcare in America? Good question. Do they need to? Better question. Thank you. The short answer is no. After all, healthcare and health insurance aren't synonyms, but they have become exactly that. Think about insurance in all other contexts. Insurance is generally used to guard against a home run. It's a prevent-defense of sorts, a catastrophe that is unlikely but expensive if it does occur. That's why people have insurance, isn't it? It's peace of mind, that's what it's about. You want to be able to sleep at night knowing that if something horrible occurs, someone is going to take care of it. You couldn't afford to just repair your house if a fire destroys half of it in the middle of the night, or actually in the middle of the day. I guess that really doesn't matter. And you have auto insurance, but you don't use it to pay for oil changes, routine stuff you take care of on your own. It's the accidents you need help with. Well, we're going to get back to all of that in our next segment. So thank you very much. Stay tuned. Welcome back to Desi States of America. All right, in a very long article that I read in preparation for this, despite falling sick this week, and I gotta say that was quite ironic given this episode's topic. Anyway, the economist Milton Friedman in this article gave an excellent overview of healthcare in this country. He cited three main trends that modern medicine has experienced: technological advances, rising costs, and widespread dissatisfaction. Healthcare is the only industry in which the last two exist despite the first one. Think about it. In everything else, technology lowers costs and improves experiences. Consider computers. Moore's law tells us that computers double their speed every 18 months or so. You can now get a very decent laptop for $500, and consumers are happier than ever. Probably mostly because of Macs, but I'm not going to get into that whole debate. Costs are rising all over the world, but the U.S. spends more per capita and more as a percentage of GDP, gross domestic product, than any other country. We're at 14%, and the next one, Germany, is at a distant second with 11%. Why do we pay more? Well, that's a tough one to answer, even for old Milty. But as he says, quote, nobody spends somebody else's money as wisely or frugally as he spends his own, unquote. And that's precisely what we do in this country. It's not your money when you go to the doctor. Not really. I mean, you're responsible for your copay, but that's the small number on a doctor's bill or that statement you get from your insurance company where it brags about what it spent on you as if you're supposed to give it up like a girl on a date, which is a good system. The other thing is that we're sort of half pregnant, like the girl after a date. Well, bad date probably. We haven't, as a country, made a decision as to whether we want private or public health insurance. So we have this sort of quasi-public-private system, and a mixed system is bad. We have high quality and accessibility, no long waiting lists, but it costs a lot more. Completely individual, like fee-for-service arrangements, would have high quality and accessibility and hold down costs. Completely collective, where it's kind of a universal sort of thing, would reduce quality, have a mixed effect on accessibility, more people could go, but with waiting lists, and costs would go up. So what Friedman proposes is this. Check this out. Eliminate the tax exemption for medical expenses so people go out and buy their own insurance. This way, the cost of health care isn't subsidized by your company, so it'd be like food or really anything else you buy. We demand better quality and lower costs, just like with anything else, because we're now paying for it. He wants to eliminate Medicare and Medicaid so people aren't dependent on the government. Classic conservative thought. Give everyone catastrophic insurance to guard against that home run. Gives you peace of mind in case something terrible happens. And finally, remove restrictions and regulations on insurance so people can buy what they want. This is actually pretty much what McCain proposes, and it appears most economists actually think the GOP, the grand old party, the Republicans, has a better plan than the Democrats. Go figure. So, let's figure. The only downsides of this plan are that the elimination of Medicare and Medicaid would leave people who are old and poor out, and so would the fact that people can now choose which plan they want. This is great for young and wealthy and generally healthy people. I just run out and go buy what I need. But this means that the elderly and the indigent are now paying more for their own because right now, if we have similar options, I'm sort of subsidizing their payments. So the McCain plan screws the old and the poor. What a big surprise. John McCain does not care about poor people. But it does use market forces to drive competition and does empower the individual. This is more likely to address the biggest problem we have with healthcare in this country, spiraling costs. If everyone is now a direct consumer, prices should fall drastically. McCain also proposes the use of savings accounts. We had that where I used to work, and it was actually really awesome, okay? Just don't give them to the stock market the way that Bush wants to tie them to the stock market. That's just not a good idea. I mean, that's what he's going to do with Social Security, and it's just not really too smart. The only thing I'd probably add is some kind of safety net. I wouldn't eliminate Medicare and Medicaid completely. I'd do what Bill Clinton and the Republicans did with welfare reform. Help people get off of it, but don't just kick them out, dude. Just throw them on the street. So what does Obama propose? Well, in a classic dichotomy of modern politics, whereas McCain relies on personal responsibility and market forces, Obama thinks we should use government and regulations. Is that a good idea? Well, in short, Obama uses pay or play. Employers would either provide coverage or pay a tax for not providing it. Given the escalation of costs, employers would probably just likely pay the tax to get it off their books. After all, you know what they say about General Motors. It has become a healthcare company that sort of just kind of happens to make cars. We'll be back after these messages.